The usual dose of diethyl carbamazine citrate is 2 milligram, 2 kilogram of body per 2 kilogram of body weight, 3 times a day for 1 to 3 weeks. So whenever a question or whenever a statement is given to you like this, you have to make sure that you look out for the things that will be important. So the first thing is, it says the dose is 2 milligram per kilogram of body weight. You have to also take into account how you want to present your data, because you can change the base unit. Are you going to work with milligrams, micrograms, grams, or anything like that? But whatever you choose to do, you must stick to it. So now you must familiarize yourself with conventions. Whether you are, if you work with milligrams only, it's milligrams throughout. If you work with grams, it's grams throughout. So it's best to know how that medicine is presented to you. Is it available in micrograms? Is it available in milligrams? Is it available in grams? Before you confuse yourself. So if you know that carbamazepine or carbamazine, for example, is available in milligram, then you stick to milligram. But if it's available like L-troxins, which are available in micrograms, then you stick to micrograms. If it's available in gram units, then you work with gram units to avoid having to convert now on the scale or during the dispensing or anything like that. So this one is available as milligram. It says 2 milligram per kilogram of body weight, 3 times a day for 1 to 3 weeks. So you need to determine the dose for an 80 kg adult. So already here, it's a good thing because the weight is already as per kilogram and the person's weight is presented to you also as a kilogram. So now the calculation will begin as simple as, it's going to be 2 milligram per kilo, therefore it's 2 milligram multiplied by 80 kilograms because your patient weighs 80. So if per kilogram of body weight is given 2 milligram, it would mean that if the person weighs 80 milligram, you multiply the 2 milligram by 80, which would give you 160 milligram for an 80 kg adult dose. So now you are giving this dose three times a day, therefore you would multiply it by 3. So it would be that dose that you got there times 3 times, which will give you that, and then that for 21 days. The 21 days is because it's 3 weeks. So you had to take in 3 things into account. The first step was to take into account the weight. The second step was to take in the 3 times per day, the dosing. And then the third step is to take in how long the dosing is. So that's the 3 things to be able to know how many would you then dispense this person to go home with. I hope that made sense. The second question, now here we go again with the convention. The dose of a drug is 12 microgram per kilogram of body weight. So here, but then how many milligrams should be administered each day to a woman who weighs 55 kgs? So here already you must do the convention first, because already if the dose is given to you as micrograms, but then the question wants you to give it as milligrams, you need to then be able to do the convention from micrograms to milligrams to grams to kilograms. Usually the convention, you can either use a convention table or you can just, I don't know, memorize it off by heart. But then there are a lot of convention tables on the net that you can print out for yourself and keep in the office or anything like that. But for this particular exercise, from micrograms to milligrams is a division by 1,000. So in most cases, the move is by 1,000. So when you move from microgram to milligram, it's 1,000. If you move from gram to kilogram, it's 1,000. So now for this particular exercise, the first step is to convert 12 micrograms to milligrams, which would then be 12 micrograms is equal to 0.012 milligram. And then that you then multiply by the weight of the person. So the woman weighs 55 kg, which would then mean that you multiply the 0.012 milligram by 55 kgs, which would equal 0.66 milligram. You present your answer as per the question, because the question says how many milligram, then you are going to leave it at milligram. And then the assumption here is that the actual medicine is available as a milligram. If not, then you just convert the answer again to microgram so that you can be able to dispense it. And then 0.66 milligram would be 660 microgram or something like that. So all you have to do with conventions is find yourself a convention table on the net that you can print out that has, it usually has arrows going back and forth as to if you want to go up or you want to go down within the conventions themselves. Now, when it comes to calculating pediatric doses, a lot of people sometimes assume that you can just, I don't know, half the dose, or assume that a child is basically a young adult. It's not always the case, because their metabolism is not the same as that of an adult. So if possible, use pediatric doses. It's only in extreme rare cases where there is no pediatric dose where now you're going to have to work with an adult dose. But even in those cases, you still have to remember that a child is not just a small version of an adult. So their filtration rate is not the same, their metabolism is not the same. So you have to take all of those things into account. In your resource guide, I believe there are 4. Yes, there are 4 different ways of calculating the child's dose, but then both, all of them, sorry for that. All of them are based on one of 2 things. It's either they take into account the age of the child or the weight of the child. The one that we are going to use today takes into account only the age of the child. Others try to combine both the age and the weight of the child, but then they can sometimes be very, very, very complicated. That's why if you have the option, rather just try find a pediatric preparation. But if there isn't, in those instances where there isn't a pediatric dosing available, then you work on a specific formula. This one is mostly the, I rather say, the simplest of the formulas. The others can get honestly very, very complicated. So with this one, you take in the age of the patient and then the adulting dose. So it's the age in years. So if you have, say, a 5-year-old, it would be the age of the child. So then you put in the 5 years there, then it would be the age plus 12 years. The reason why it's 12 there is because in most cases, the assumption is once a child turns 12, then they, in most cases, qualify for some of the adult dosing. So it becomes age, then that would be 5 plus 12 multiplied by the adult dose. So whatever the adult is allowed to take would then, you would then use here, that will equal whatever the dose you want to give to the child. But again, there are, I think, 4 to 5 different ones within your resource guide that you can look at and determine which one works for you. But usually this one works best. So like within this example, it would be 8, then 8 plus 12 multiplied by the 50. That will give you the dose of the child there. So with this one also, again, it is a formula that you are allowed to print and practice on, or just keep safe somewhere there, but then only for those instances where there is really not any available pediatric preparation for you to use. The next example is how many grams of phenol are required to prepare 80 grams of ointment containing 5% milligram per milligram of phenol. With this one, usually with preparations, it depends on how the prescriber wants to prescribe. Others are going to give you the percentage they want, or they're going to give you the gram that they want within a specific gram. So now you need to be able to calculate the concentration. You need to know if you're giving a patient anything, you need to know, is this a 1% preparation? Is this a 4% preparation? Because also the absorption of the skin differs. You can't be giving a 10% concentrated solution, whereas maybe a 1% would be sufficient, because some of these preparations get very quickly absorbed through the skin, and you don't want to overdose your patient. So now, if it says how many grams of phenol are required to prepare 80 grams of ointment containing 5%. So here, the total gram is 80. The total mass of the final product is 80. But then within that 80, 5% is phenol. So this one, you need to be very careful. You need to first be able to establish what is the total mass of the final product, because then only then will you be able to know how much of the active ingredient do you put in and how much of the base do you put in. So if the total mass is 80 gram and only 5% is your active ingredient, which in this case is phenol, it becomes 5% of 80 gram is 4 milligram, right? Or 4 gram rather. Sorry for that error. 4 gram. Then you know that when you are preparing this solution, it becomes 4 gram into 76 gram of your base. Then the total becomes 80 gram. It can't be 4 gram of phenol in 80 gram of a base, because that will no longer be 5%. So when you know the strength and the total of the actual preparation, it becomes slightly easy, because you know that whatever the mass you find of the actual active, you subtract it from the total, and then the difference is covered by the base. I hope that makes a bit of sense, because if you put 80 gram of the base, then the concentration will no longer be 5%. It would be less than that, because it would be 4 gram in 84 gram. Then it's less than 5%. But for it to be 5%, it must be 4 gram phenol in 76 gram base, ointment base. Example number 5, calculating the total amount of medicine needed. So if now you have to dispense amoxicillin for 5 days, but then you are given the 250 milligram capsules to take 3 times a day for 5 days. How many capsules must you dispense? So again, the first is, at least you know that the dosing is 250 milligrams. So they take 1 capsule, TID, TDS, 3 times a day for 5 days. So the first is to multiply 1 capsule 3 times a day, which will be 3 capsules. Those capsules must last the person for 5 days. So it's 3 capsules per day for 5 days, which would equal 15 capsules. If somehow the required dose was 500, then you'd have to first multiply this by 2 to give the correct dose required per dose. But then with this one, it's only 1 capsule. So it becomes 1 capsule multiply 3 to make it 3 times a day for that 5 days, which would then be 1 times 3 is equal to 3. 3 times 5 is 15. Then the total issued is 15 capsules, because the intention here is that when the person leaves, they must have enough medication to last them the required treatment period. When it comes now to a pediatric dose, you are trying to determine how much of the solution or how much of the suspension the patient must live with. Again, it's still amoxicillin, 125 milligrams, 3 times a day for 5 days. How many mils must be dispensed? after reconstitution. So this time around, you are actually mixing, and then you've discovered whether or if after following the guidelines of the bottle, it says that after reconstitution, it should be 125 milligram per 5 ml. So you know already that if it says it's 125 milligram per 5 ml, that means when you give one full measure, which is usually 5 ml, because most of those dispensing measures, when you give one full measure, it's 5 ml, then you know that with one full measure, you're already giving the required 125 ml. So there's no need to multiply that there. Then you know that with 1 5 ml, it's going to be 1 5 ml 3 times a day for 5 days. Therefore, it becomes 5 ml times 3, because you're giving it 3 times a day, which is going to be 15 ml per day, but then it must last for 5 days. Then it becomes 15 ml times 5, which will equal 75 ml. Usually the preparations are either available as 50 ml or 100 ml after reconstitution, which would then, you would usually give out then the 100 ml instead of the 50 ml, because then with the 50 ml you're underdosing, but then with the 100 ml, at least they can then discard, or rather bring back to the pharmacy for you, to the facility for you to discard if the other one is not used, because they can't keep it for reuse later. And then there is the usually problematic prednisone calculation, because prednisone requires usually a very high dose, but then is available currently only as a 5 milligram, because I believe the 20 milligram was discontinued. So now your prescription comes in. This treatment must last for almost a month, but then the dosing usually goes down as the patient. So usually up the dose at the beginning, but then down titrate up until they finish. So the prescription reads 80 milligram daily for 3 days, then 60 milligram daily for 3 days, then 40 milligram daily for 3 days, then 20 milligram daily for 3 weeks. So now you need, but then your tablet is only available, as already mentioned, as a 5 milligram tablet. So then it becomes a division situation where you know that, okay, fine. So for the first 3 days, they need to take 80 milligram, right? So it becomes 80 milligram divided by 5 milligram, which is 16 tablets. So for the first 3 days, they're going to take 16 tablets for the first 3 days. So for them to have enough prednisone for the first 3 days, it's 48 tablets, because it's 80 milligram, which is required, divided by the 5 milligram, which is what the tablet comes in, gives you 16 tablets. That's 16 tablets per dose. But then now it's 1 dose a day for 3 days, then it becomes 16 tablets times 3, which becomes 48 tablets for the first 3 days. Then the dose goes to 60 milligram daily for 3 days. Then it becomes 60 milligram.
And have you even ever considered that about him, Neil?
Okay, it then becomes 60 milligram per 5 milligram, which would be 12 tablets, and then 12 tablets for 3 days becomes 36 tablets. 40 milligram per 5 milligram, which is 8 tablets for the next 3 days, which becomes 24 tablets. And then the last one is 20 milligram per 5 milligram, which is 4 tablets. But then now these 4 tablets is daily for 3 weeks. 3 weeks is 21 days, which becomes 84 tablets. So now your total will become all of this, because remember, you want to issue enough tablets for the patient to last the entire month. So you then give out 192 tablets, and then you try your level best to label it correctly and have a proper discussion with the patient. They must know that they're going to take 16 tablets per day for 3 days. Then they lower the dose to 12 tablets per day for another 3 days. Then they lower it to 8 tablets per day for another 3 days, and then lower it to 4 tablets per day for the remaining 3 weeks. The last calculation is if 10 grams of charcoal is mixed with 65 grams of another powder to make a total of 75, the charcoal concentrate is what? So in this situation, you must then calculate how much or how concentrated is the mixture that you are giving out to the patient. So already you are adding 10 grams of charcoal into 65 grams of a base powder to make 75. So the total mixture is 75, but then within that 75, 10 grams is charcoal. Then it becomes 10 divided by 75, which would then be 0.133. And then you need to make that as a percentage because all your concentrations are easier if you present them as a percentage. So for your POE, you have 2 questions that you need to work on. And then these 2 questions are: the recommended maintenance dose of bentonite, which is your inhalant, is 100 microgram administered twice a day. So now it becomes 100 milligram BD, and then the conventional inhaler delivers 50 microgram per meter inhalation and contains 200 inhalation. So already you are, the information that you've already gathered is that the patient needs 100 microgram twice a day, right? But then what you have on hand is per puff or per inhalation is 50 microgram. That already tells you that per dose administration, it must be 2 inhalations, because now if one inhalation delivers 50 microgram, but your patient requires 100 microgram. Therefore, it must be 2 inhalations twice a day. So that already tells you then that already per day, they are going to use 4 inhalations, because per administration or per dose, it's 2 inhalations. And then now already the container only contains 200 inhalations. So how many inhalers should be dispensed if a 60-day supply is required? So I've already told you that each day it's 4 inhalations. So already you can calculate that, okay, fine. If the container only gives me 200 inhalations and per day they use 4 inhalation, how long can one container last? And then from then on, you will be able to know how many must you multiply those to be able to give you a 60-day inhalation. If for some odd reason it becomes a 2 point something or 1 point something, then you round off. So obviously, because you can't open the container and give 1.5 of an inhalation of an inhaler, then it's going to become 2 inhalers. If the answer that you get is 2 point something, you can't give 2 point something. It then becomes 3 inhalers. And then the second question is, if one spray supplies, no, it is the same question. It was just the breakdown that I gave now up there. And then the second question is, the following regimen for oral prednisone tablet is prescribed for a patient: 50 milligram per day for 10 days, 25 milligram per day for 10 days, 12.5 milligram per day for 10 days, 5 milligram per day for 10 weeks. How many scored 25 milligram tablets and how many 5 milligram tablets should be dispensed to meet the dosing requirements? When you are dispensing to a client, pill burden is something that we take into account very much. So the aim here is that you should try limit pill burden as much as possible. So to reach a 50 dose, you can reach it with the 5 milligram, but then you are pill burdening the patient. So if there is an option of giving a pill that is of a higher dose to be able to reduce the amount of tablets given to the patient, you go for that. So like, for example, with the 50 milligram per day for 10 days, you would much rather give as many of the 25 as possible compared to the 5. With the 25 per day, again, you would rather use the 25. With the 12.5, cutting on the 5 will be very difficult, but cutting on the 25 is much easier to do. And then with the 5 milligram for 10 days, then you would use the 5 milligram. So now with this question is, you would then first have to decide which ones are you going to use first. So for the 50, the 25, the 12.5, the 5 milligram, which one are you going to issue? Are you going to issue the 25 milligram? Are you going to issue the 5 milligram? And then how many of each? So your answer must indicate that you are going to issue, I don't know, 10 tablets of the 25 milligram and 30 of the 5 milligrams to the patient, and how must they take it? So now you do your calculations here. You need to decide for this dosing, which one are you going to use, the 25 or the 5 for this dosing, because remember, they're going from 50 to 25 to 12.5 to 5 milligram as they're down titrating until they finish their course at the end of the last 10 weeks. So now you need to be able to indicate that, okay, for me to be able to, number one, lessen the pill burden for the patient and still get them the right dosing, which one are you going to use for how long? So I hope that the other question there helped. Then they gave you a bit of information that in the government or public sector, only the 5 milligram is available, but even now the 25 has already been discontinued. But for the purpose of this exercise, you will still calculate as though the 25 milligram is still available. I hope that it helped. And if we have any questions, let us see if we can get them sorted out so that we can begin the actual activity. Any questions, anybody? Have we tried doing the calculations yet? Peter, I see you unmuted your mic. Do you have any question? Any clarity required anywhere? I see Ellie said the calculation there had an error. Yes, it wasn't supposed to be 160. Yes, apologies for that error there, Ellie. Thank you for that. Anything else? Are we all ready to do our 2 examples or our 2 activities? So everybody is ready to be able to dispense any prescription that needs any calculative reconstruction. Dr. Les, are you also okay?
I'm always okay. I'm always okay. Thank you very much, Liz, for the session. And I think you have outlined some of the important calculations, but importantly, some tips around, is it learning activity number 4?
Yes.
Or 5? Yeah, anyway, calculations. Can I just check? Hlengiwe, are you there? Hlengiwe? Please unmute your mic if you are there. Hlengiwe. Hi, Hlengiwe. Hi, Hlengiwe. Kabelo. Udenge na. Kabelo, are you there? Hi, Kabelo, are you able to hear me? All right. Noluthando.
Hi, Dr. Mawela. It's Klingu. I was having difficulties with unmuting. I am here.
Oh, that's better. You gave me hope.
No, we're here. We can hear very well.
Just to hear your voice is good enough.
Thank
Yeah,
you.
and how are you doing, Seslengiwe?
Okay, to be honest, I haven't started much, but it was my first time in the. Okay, can you hear
Just
me?
wait.
Okay.
Yes, just wait. I'm going to need to mute some people because otherwise they're giving us feedback. Yes, you can continue, Hlengiwe.
Okay, I was saying I haven't started much with the dispensing course. So
Okay.
today it was my first time doing the online, the dispensing, because I was busy with the Nimart one. But I have learned so much from the lecture that the lady gave with the calculations, especially the PEDS one. It was the first time I see the age plus 12. I was really fascinated because I haven't started. I just with the dispensing, I just saw the intro that you were doing on the dispensing course. So I've learned so much tonight.
No,
Yes.
that is important. And just to everyone, don't be overwhelmed because we are already at learning activity. We don't stop. So when we get to learning activity, we are going to restart and do 1, 2, 3, 4. So, these learning activities, yes, you might be busy with learning activity 1, but if you're able to do your calculations between today and next week, Wednesday, that would work well for you, Don't
Okay.
or you can do them randomly. And then eventually we will go through all the sessions. When we get to learning activity 8, we then start again 1, 2, 3, 4, until the end. So we have these sessions every Wednesday. Yeah. So I hope you continue to join us on Wednesdays, Tlengiwe, so that you are also inspired to not default. As Funama default.
I'll try not to be a defaulter.
Do it and then you are happy at the end. Yeah.
Yes, thank you very much. It helps a lot. It helps a lot, Takulu. Thank you very much.
No problem. Kabelo, I'm noting your apology, but can you say hi, Kabelo? I need to hear your voice. KB.
Good evening, everybody. Yes. Yeah. I'm here, and
Yeah.
I was still busy doing Nemart, and I'm now doing mentorship, and I haven't started the dispensing. But like Hlengu have said, it's a very interesting and interactive session to have.
Yeah.
Thank you very much, guys.
Also, you are just joining to keep check so that when you are done.
So that when I get to dispensing, then I know that all the tricks.
All right. No, you are welcome anytime. And I'm hoping the sessions will make your life easy when you start to do your dispensing course. Yeah. Perfect. Thank you for that. Ellie, Sister Ellie.
Yes, I am here.
Yeah, how are you doing?
No, I'm good.
You're
it's
good.
Also my first session, and I haven't started yet. because
Yeah.
I just registered now this week. So
Okay.
I'm happy to do the course.
All right.
Yeah.
That is good. Yeah. So yeah, so don't panic also, you know, it's
No,
your
I won't.
session, and we are at session number 4 or 5. You know, I know when you
Yeah.
start to access your e-learning, it's gonna start you with learning activity number 1. Just go with the flow. And actually, you know, if you, like I said earlier, if you're able to do those 2 calculations on learning activity, is it 4? And just get it over and done with, so that if you have questions, you can then ask. Even in next week, Wednesday, you can ask there and there, you know, because at
Yeah.
the end, you want to do all of them. Yeah.
Yeah. No, I will.
All right.
Thanks. Yeah.
Oh, you are welcome. Thank you very much for joining. Let
Thank
me,
you.
if I can hear one more voice, just to make sure that everyone is okay. And Tabiseng, are you there? Tabiseng, Makwale.
Hello, Doctor. I'm here.
Yes. How are you feeling today?
I'm okay. I'm coming all right. I'm just
All right.
stuck a bit with getting SOPs. Working in public facilities has proven to be very interesting. These things are non-existent there, so I'm trying to find them. But
Yeah.
besides that, I've completed most part of the portfolio.
Oh, so you are doing learning activity 7.
Yes.
All right. All right. Konje, what does it say? You have to develop an SOP or you have to evaluate an SOP? What
You need to evaluate. So I'm trying to see if I can get a few nyana that I can work with, either from clicks
No,
or
you need
just
to submit only one, not too many.
Yeah, I felt I needed more just to work on it some more, like have options and pick one that I'm most comfortable with sharing.
Yes, yes,
Yes.
yes. And
Striving for
then
excellence.
no, it's perfect. It seems like you are done. So yeah, do take your time, and then when you are ready, do submit so that we can submit for the assessors and moderators to then evaluate and give us
I'll do
feedback.
just that. Thank you so much.
Thank you. And Nolutando is saying the calculations are overwhelming, especially the PEDS. Yeah, calculations are overwhelming, but please do practice, because in your open book exam, the multiple choice, there's also calculations there. So you need to really, but you know, lastly, as we close as I say my last comments, let's all remember that the dispensing, I know most of us are doing it because maybe you want to, I don't know, get a job, a better job, or sometimes to open your private clinic. But at the heart of dispensing, really, it's issues of patient safety, you know, and minimizing medical errors and harm to patients because of drugs. So I want to encourage you to really do as much as you can, to learn as much, because these are the things that you should be doing on a daily basis and putting in place in your clinics or where you work, just to improve the quality and the safety of our service. So yeah, just to encourage you on that note. All right. Yeah, so from my side, just to say thank you very much. And then hi, Lenovo, do you want to say something? Because your Lenovo tab, I see you are saying hi. Now I can't call you by name because it's written the name of your gadget. Yes, you want to ask something?
Yes, hi doctor.
Please, I need your name.
Usizakele, man, I'm using a work tablet. I didn't know
No,
my
it's
name was.
okay. Okay, Zizagele. Yes, how can we help you?
Doctor, I just joined. I've paid my dispensing course, I think 3 days ago. I
Okay.
don't know to Gwenzagalan. You know what? I'm just lost. I hear people have already started. Some are not doing the course. I'm not sure where do I fall. I'm in the right group. What is happening?
No, it's okay. You know, you should try to join in early, even next week, because every Wednesday when we start, the first 5-10 minutes, Lisbeth explains the course. What is the course? How do you do it? What does it take to pass? I said to her, she must repeat it every week, because sometimes towards the end, that's when we get a lot of questions, which is a bit unfair, to you. So please try. We do these sessions every Wednesday. They are more on the support side, just to ensure and keep you going, and then giving you guidance on the different learning activities. There's 8 of them that you need to complete, and then you submit your portfolio of evidence, which is part 1 of your steps towards completing, So if you have registered, the first thing is, if you have paid, the first thing is for you to then submit your proof of payment. And then there's a very nice lady called Lorraine, who would then help you to get access to your e-learning course. She'll probably add you to a WhatsApp group, and then also share the key 2 manuals that we use for the course. When you do now access your e-learning platform, you'll see it's also taking you through these 8 learning activities. You just follow the course. There'll be the overview, and then it says learning activity 1 with some tips, learning activity 2 with some tips, But also when you come to these Wednesday sessions, you get a chance to ask questions, and check the work that you have done based on what we are teaching, whether there's blind spots, especially before you submit. And then at the end, you submit, and then you are happy, you pass, and then, So I'm not sure whether you have access to the e-learning course. Have you been given the platform access?
Yes, I've been given, but I haven't got a chance to actually look at those. I just saw Guti today, there's a class. Then I just joined the class, but it was very difficult to join the meeting.
This one we are supporting. So it's both. You will do your self-paced work where you work alone and do the work as per what the e-learning is going to tell you. But every Wednesday, do join us because it's easy here. You can ask. So ideally, when you come here, you like next week we are doing learning activity number 5. Ne? Is it patient? Is it the labels, or is it what you call the patient information? Liz, what is learning? The next learning activity?
I think it's patient counseling.
Yeah, is the one of the patient information and package inserts. It's very easy. So between today and next week, just go and look at learning activity number 5 in your learner assessment guide. You can start doing your drafts so that when we do it together, you are able to ask questions, and then you are able to prepare. And don't be overwhelmed. It's a mixed group. There's people who started 2 weeks ago. There's people who started today. Others started on Friday. It doesn't matter. You just keep on going with us. Eventually, you'll cover all the learning activities. Ne?
All right, Nyabonga Tokotela, thank you
I'll
very
be
much.
overwhelmed, but you'll be inspired. You must be inspired.
I need dispensing license, eh?
Yeah. No, it's okay. Thank you for joining us. Yeah. So thank you very much, everyone. Liz, may I hand over to you to then conclude if there's
Yes. Thank you, everyone. Hoping that those who just began the course now will have enough time to look through learning activity number 5, and hopefully a bit of 4 as well, so that by next week we can maybe relook at what needs relooking, and do a bit of 5 and do 5 as well. Thank you very, very much. Hoping that everyone has a great night, and see you next week, Wednesday. Good night.
Thank you. Bye.
Good night. Bye.
Yes, bye.